as she's already announced, my name is Angela Mull, and I am the sickle cell nurse at Arkansas Children's Hospital. Been working with Dr. Sacente and Dr. Patterson. I want to first discuss the nursing role that I play in clinic, but I wish more nurses played in the outpatient setting of pediatric care centers. One of the things is that making sure those babies get to where they need to be for testing, following up with the family so that they understand that when you send them to children's, that the baby actually has something. We encounter this a lot, almost every week. We'll get the family into the clinic if it's a new baby. You sit down with the family, you walk in, I'm the first person they meet. I say, do you know why you're here? Their first answer is, my doctor just sent me over and told me something was wrong with the baby. I just need to come here for a blood test. Well, did your doctor review what that blood test was for? No, he said something about sickle cell, but it doesn't run in my family. So then we have to start at the ground, which happens to be sickle cell education and disease education. The big deal about that is that when a baby comes in with a positive newborn screen, part of that should be a family history with that baby. Does the father's family have it? So they kind of get a clue in that something genetic is happening. Not that the baby caught something at the hospital, or it's not my baby mama, or my baby daddy. We get a lot of that. I mean, there's a lot of drama that comes into our clinic, because he's sitting over there, it don't run in my family. She's sitting over there, this is your baby. He's sitting over there, don't look nothing like me. I mean, it's a constant discussion. So you kind of have to break down that barrier right at the beginning, because it hasn't been really brought forth in the pediatric setting that they're familiar with, which is their pediatrician's office. So for me, for nursing care that I'd like to see is that when they come in, you already know that they have a positive newborn screen. Ask the family, talk to them a little bit about their family history so that they kind of get clued in. It's not just coming to children's and we go chat, draw some blood, and then go home. Because the first visit is about 2.5 hours. Because we have to cover genetic education, family education, infection education, when to come back, make sure they come back to their pediatrician's office for their immunizations. That's a big deal to them, because they don't realize they come see us every 3 months. They have to come to the pediatric setting every 2 months. So what, every other month, what are they doing? Going to the doctor. What does that entail? Scheduling. What does that entail? Making sure we communicate. And that's hard for some parents. They're really difficult, especially for those who are teenagers. That's really difficult for them. So we just need to be mindful of that it is a disease that requires a lot of patience, a lot of education, but it also requires us to do our job, which is doing good history taking. Okay? The other thing that I like to see is that among physicians, encouraging the use of new technology that's out there. When they are sick, one of the chief complaints we'll get from pediatrician's office is, why do we give them narcotics? We don't overuse the narcotics. We really try to make sure they don't go home with too much. We also have a pain management clinic that is available at Arkansas Children's Hospital, should it become a worry. But you have to remember that narcotic addiction among sickle cell population is only 2% nationwide.
Say it one more time.
2%.
All right. One more time.
Nationwide. So there's this whole, this is what Dr. Sacente's heard me say this many times. It becomes almost a black-white thing. And that's not to be a negative stereotype, but it is. When you enter the ER for pain, and you know, because you have sickle cell disease, pain is part of your disease. A nurse shouldn't roll her eyes because of the fact, or a doctor should not roll that, well, Dilaudid works best for me instead of morphine. Ooh, they must want drugs. No, they know what works for them. Part of their disease is pain. The best part of our education process is we teach them the drugs so that they can manage their pain. So when they become adults, they show up in the ER and they don't know the difference between all the different narcotics. It's not because they seek it out, it's just because that's part of their life. So understand that. And understand the fact that we need to use the technology we have. All right? You on one page? So I told y'all that nothing need any help. No mic needed. The other thing I wanted to bring up, which is funny, pediatricians' offices, I think, are not so notorious. It's when they get to be adults that we need to be mindful that they may need disability or SSI when they qualify. This sickle cell itself is not a disability. I want to put that out there so it's not a mystery. Because I got many a mama who clown. Well, my doctor told me I get it. I don't have to work because my baby gets a check. No, your baby don't get a check. And that's used a lot, okay? So we need to be mindful that sickle cell is not a disability, okay? They can have disabling complications and require it, but sickle cell alone, not a disability. We clear? Yes. All right, my next thing is roles for community, or just the community in Arkansas. There are many things that stand out, but to stem off of Dr. Sacente's talk, the most important thing is blood donation. In the African American community, we are the least donors there are. You all do not realize how important it is to have African American donors that are sickle cell negative. The reason being is because African Americans have certain antibodies, and it's natural. Any, as I call, any ethnicity or race has its own little quirks. And everybody thinks that's bad, but that's just part of what God created. And it's not a thing that separates us, it's just something that makes us a little different. But we need to decrease the amount of troubling reactions that can occur when you have a blood transfusion. So in the Black community, we need to get out there and donate blood. So churches have a blood drive, get in line. Bring the family, because if they're 16 or older, they can do it. Central High, J Fair, and I think Hall High. Those are the three schools, I think, yeah. If you're 16 or older, blood drives are held there 3 times a year. Okay? So if your kid comes home and says, I want to donate blood, cheer them on. Say, go donate that kind of blood. I love that. Just remember, it's important in our community that we do for our own people. Part of that is understanding what blood drives mean, okay? We're not testing, doing experiments. We're past Tuskegee now, so we should be not afraid. Just want everybody to know. But we need to encourage that, okay? Blood drives are important, but people tend to ignore them. People tend to ignore them because they don't understand. So maybe you're that example they need to see. Encourage blood drives at your church. Believe it or not, we hold blood drives on Sundays now. Yes. The Red Cross here is willing to organize that. And we're one of the very few Red Crosses that do that. So on Sunday after church, y'all can provide snacks, they can hear the preacher, and go donate some blood. Then they go home. As long as we're in Black churches, we have plenty of time. So we have plenty of time. And that's the most important thing. We make light of it, and that's one of the things about it is make it a fun event. Donating blood, get a t-shirt. Donate blood, we don't have to stay in church as long as Sunday. Okay? Trade-offs. The other thing is getting involved in different health organizations that do education type things for the community. One thing about it that I really want to get also across is that in sickle cell clinic we see a lot of Hispanics, in just hematology alone, I'm sorry. But in sickle cell we have three Hispanic families. It's a big deal to get past the cultural vision that most people have is that it's a Black disease. We have quite a few biracial babies that have SS disease. And a lot of people can't get past that. And Dr. Sacente and I laugh because they'll call us, this baby is white, got blue eyes. Yes, they're still our patient. And so it's a funny thing because here we are in 2012 and people do not realize racial mixing, also that the Greeks, the Italian, the French also have sickle cell. We just don't study enough and we don't continue that in the healthcare community, okay? So we shouldn't just have one face on a disease. The disease doesn't have a face of its own. It's just for us to project who those people are. And they're multiracial, from different ethnicities. We just need to be mindful of that, okay? Also, I'd like to see all these organizations in here put on a family conference during Sickle Cell Month. And that's during September. So families don't have to go to Maryland like they have to this year. And they can go for like $50 or something like that. It's a reduced fee. Problem with that is, you gotta take all the kids. You gotta take the husband, or baby dad, whichever one you choose. But the funny part is, they can't afford to do that, to go that far away to get education, when we have great educators right here in Arkansas. Who can do that? We have that ability, we just don't come together enough. So we really need to start thinking about working together with all these different groups, but also talking to the different physicians so that they can learn more, so that they're more effective at teaching, especially in their local spot. The other thing is, during Sickle Cell Month, I think all black churches should have posters or something that says, this is Sickle Cell Month, not just our disease. And have pictures of different people so that they don't feel like they're an isolated community, like they do with diabetes or high blood pressure. 'Cause that's something that gets misnomered, so that we'll know it's bigger than just us, okay? The other thing is transportation. Medicaid is a big deal. Making sure that they get their Medicaid is a big deal. But transportation within the city, just in Little Rock, we have difficulty getting a patient from the north side to sickle cell clinic because of lack of transportation through Medicaid. And that's a big deal, thinking about, why can't they get a ride? Can they catch a cab? Not so easy when you got to bring 3 kids and only one of them is actually needing to be seen. Or you're trying to coordinate appointments, but you got to coordinate transportation. And your friend won't do it, baby daddy won't do it, grandparents don't live nearby. So it's up to us as health educators, also healthcare workers, to help them understand that transportation is available and help them get it solidified early for their appointments. Because if you have to send a letter now and do all those things are things you have to do with Medicaid, period. You have to justify why they got to come, how far the distance is. And especially those of mine who live in like Helena, they get picked up at 2 in the morning. Sometimes 3 o'clock in the morning. Nobody realized that? They get picked up early. They stay awake through the night. They stay on their van because they go through all those little bitty cities. They drop them off at Children's, and where they drop them off is the only place they'll pick them up. So if the kid has multiple appointments and they happen to be in different areas of the campus, mama has to think through that, because she got to be back at a certain spot at a certain time. But we need to think about doing better about transportation and education on how to get there. Okay? Sponsoring families in need for the holidays. Our social work department has sponsors. Our cancer patients have sponsors. Our hemophilia and bleeding disorders patients have sponsors. We don't have sponsors for the sickle cell patients. That's always a problem every year, because the sickle cell support services, they're usually able to do 2 families. We've even called churches and they've turned us down, just to sponsor a family just for food. And we have families that are in need throughout the state. So that's something we really need to focus on as well. And if you ever have any questions, call me. I am willing to talk to you, help you figure out who you need to get in contact with, how to organize something for the sickle cell community. That's what I'm there for. And hopefully we'll have the adult sickle cell clinic up very soon, because I think the funding is complete. It's finding a doctor for it, then educating the staff about it. Those are things that are a big deal, because our patients now live past 20. And that's a good cheering point. Right there, we should have prayed, right? Prayed right there. So that is an accomplishment. And that's for any disease in the black community, especially when we are able to say we progressed from 20 years ago to where they live to be complete adults, to able to do things, go to college, have children, and able to work in our community. That's the time to cheer. Thank you, guys.